let's move on to the first lecture, which is the relevant facial anatomy on cadaver dissection and what to be aware of. It's a very close friend of mine, Dr. Shilpa Taneja MITTAL, who will be speaking on this. And Shilpa is a very well-known oculofacial plastic surgeon from Delhi.
So good morning, everyone. So next few minutes, I'll be taking you through relevant facial anatomy on cadaveric dissection. And as we all know that anatomy is the most basic, yet the most relevant and important part before any surgery or any procedure. Why should we learn anatomy well? Obviously for safe and efficacious injections so that we don't go wrong. And to achieve consistent results every time. We should know what we did before, and then only we can judge ourselves and do the thing rightly or in the best possible correct way the next time. So I have divided this presentation for convenience. Will this message troubleshoot sound problems will be there? It's not going, okay. So I have divided it into 3 parts. First part will cover the upper face, second the middle and lower face, and third the vasculature of the face. Starting with the first part, the forehead. We all know the most important muscle is the frontalis muscle, the only elevator of the forehead. It goes from medial to lateral and usually bifurcates into a V-shaped pattern as shown in the picture. Although not in this cadaveric specimen, it is not bifurcated in this specimen. When we need to inject neuromuscular agents, ask the patient to animate to know whether the frontalis is a uniblock or a divided muscle. Next is the corrugator and the procerus, the depressors of the brow. The corrugator, as seen, lies here, and the procerus in the center. When we need to inject into these muscles, we must inject deep into the belly of the muscle. After we have known the elevators and the depressors, we all know the glabella is the most common site of blindness or vision loss after filler injections because of the multiple vessels in this area. So we must always inject very small bolus and in a small fashion. That is why this becomes a danger zone, because the supratrochlear and the supraorbital vessels are there, and we might inadvertently inject fillers and have some complications. Next are the supraorbital nerves, which travel into the center part of the half of the forehead here. If we inject neuromuscular agents here, we might cause some neuromas and pain to the patient. Deep injections into the corrugator muscle here also are sometimes very painful to the patients I've seen in my clinical practice. So the supraorbital nerves and vessels travel here in the center, and we should be cautious while we are injecting the frontalis muscles injection here. The fusion zone between the frontalis muscle and the temporalis fascia and the muscle is important to note. The temporal part of this area starts from the line connecting the lateral canthus to the root of the helix here. Inferiorly, it is bounded by this line, and superiorly by the fusion zone. So this is the temporal area where we need to inject filler sometimes in few patients. Again, we should remember the danger zone. 1 finger breadth above the lateral brow is the superficial temporal artery, and the frontal branch of it lies here. And inadvertent injections into this can lead to complications again. So always aspirate before you inject. As we lift the superficial temporoparietal fascia, here lies the middle jugular vein, which is a big vein. Injections into this vein drains into cavernous sinus. So drainage, the retrograde flow of the embolus again can lead to complications, severe life-threatening ones. So when you're injecting in this temporal area, one must be cautious. Always aspirate before you inject. The safest area when we want to inject in this area is between the skin and superficial temporoparietal fascia, or very deep after aspiration. So after we finish the first part, that is the forehead. So as we can see in the diagram, this area between the skin and the superficial temporoparietal fascia is the safe zone, and deep lies the threatening vessels. We come to the next part, which is the mid-face. The most important structure here lies here, the frontal nerve. It gives branches. The superficial temporal artery is the main thing to remember here again. One finger breadth along with it lies the nerves from the branches of it. The aesthetic contours are formed by the facial fat planes, the superficial ones and the deep ones. There are 21 facial fat compartments. The malar area is the important one, which we must know. It is divided into the inferior, middle and superior, as shown by this video. The inferior, middle and the superior. In females, we usually inject up in the zygomatic arch area, and males, we inject here deep into the malar fat pad, in the malar fat pad compartment. So these are the important fat pads we must always remember. The next important part is the infraorbital nerves and vessels, which lie medially, as we all know, being ophthalmologists. When we need to inject in this area, always inject lateral and massage the filler medially, so that we don't inadvertently damage these important structures here. And also, injecting the fillers medially might accentuate the nasolabial fold, so it is avoided any case. The next important structure to remember here is this vein, which we can see here, the bluish vein, the facial vein branch. It is in the superficial fats. So again, injecting deep here into the deep malar fat pad helps, and obviously aspiration is the key. The important structures to be noted in the perioral area are the 4 major mimetic muscles of the face: the zygomaticus minor and major, and the levator anguli oris, and the depressor anguli oris, and the relationship of DAO and DLI. So these two here we can see are the zygomaticus minor above and the zygomaticus major below. We must remember, when we are injecting for crow's feet here, inadvertent injections into the insertion of these muscles may lead to the ipsilateral frowning of this depression of the smile here, the droop of the angle. So we should be cautious and inject superficially near the lateral canthus. This is the levator anguli oris muscle, and this is the broad fan-shaped muscle here. We can see the depressor anguli oris muscle. Deep to this DAO lies the next important structure, the DLI, depressor labii inferioris. When we need to inject in this area, we must always inject lateral and not medial. Injecting medially can lead to the drooping of the lower lip, difficulty to the patient in eating, swallowing, salivation can happen. So 1 finger breadth lateral to DAO lies the most powerful muscle of the face, the masseter muscle. Injections into the masseter are done for bruxism and for facial symmetry and thinning down the masseter muscle also. And this injection here will show that the masseter muscle is quite deep below the all facial fat pads. And when this syringe is taken out, we can see that around 1 to 1.2 centimeters deep we need to go to inject neuromuscular agents into the masseter muscle. So this is important thing to note. Next thing which we need to see are the vasculature of the face. The most important facial artery, which starts very deep into the face lower down, and as it goes up, it becomes superficial near the ala of the nose. It lies 1 thumb breadth away from the angle of the mouth here, as we can see, and it gives branches at the commissure known as the superior and inferior labial artery. The superior and inferior labial arteries lie at the junction of dry and wet vermilion, and they are usually deep below the orbicularis oris superiorly, and inferiorly they are deep to this muscle, the DLI. So this is the artery which we can see, and this is the DLI. So when we are injecting in this area, inject superficial, not very deep. Don't go below 2 to 3 millimeters for lip injections. Otherwise, again, embolus can be there in the arteries. Here, this artery becomes superficial and lies 1 finger breadth away from the ala of the nose. When we are injecting just beside the nose, we usually go deep and aspirate. That's the reason for it. And plus, we want to embed the filler basically there. As the artery goes up near the nose, it gives various branches. The branches anastomose with the columellar vessels, the dorsal nasal vessels, and the vessels are the radix here. So the most safe part here to inject is the middle part of the nose, which is the safest zone. Otherwise, the embolus can travel in a retrograde fashion. So these were the important structures. So the lowermost part is not a safe zone. The uppermost is not the safe zone. The centermost part is the safest zone, the SMARS area. With this, I would like to finish my presentation. Thank you all for your kind attention.